yoga problems and osteoporosis, yoga and brain injuries. There is limited empirical support for the claim that yoga can cause brain injuries. The study's design excluded a control group and used small sample sizes, which makes it difficult to extrapolate its findings to other individuals. Regardless of the drawbacks, the study provides some important information to further understand the relationship between yoga and TBI. One person who suffered a traumatic brain injury has found yoga to be extremely helpful. She was in a coma for 6 days after sustaining the injury, which left her with memory loss, a deteriorating mood, and vision problems. After undergoing yoga, her condition improved and she no longer needed glasses. After learning about yoga's benefits for people with brain injuries, Kevin is now involved in a nonprofit organization, Love Your Brain. This organization focuses on improving the quality of life for individuals with TBIs. It runs yoga retreats and offers programs for those with TBIs. In addition to providing a community for those with TBIs, Kyla also offers yoga classes for people with brain injuries. Adaptive yoga for people with brain injuries is designed to be different from regular yoga. It is designed to be done slowly and with care. A certified instructor must carefully monitor the patient's progress and adapt the exercise accordingly. This means that the yoga poses must be modified to support the recovery process, while reducing the risk of injury. Researchers have also discovered that yoga can help people who have suffered from TBIs improve their communication. A recent study showed that those who participated in a yoga intervention saw an improvement in their DARES and QOL-IBRI scores. The researchers also observed an increase in their participants' ability to control their emotions. Adapted yoga for people with brain injuries is complementary to traditional medical care and is a valuable alternative health practice. Its benefits are often self-perceived by those who suffer from brain injuries and validated by the yoga instructors. As a result, yoga helps them improve their quality of life, manage the psychosocial sequelae, and have an improved physical portrait that can cause back injuries. The best way to avoid yoga-related back injuries is to focus on strength and proper posture during your sessions. This can be as simple as keeping your posture, which is important for keeping your back straight. It will also help you strengthen your core muscles. Incorrect alignment in certain yoga poses can cause serious damage to your back. Overstretching and limited flexibility can also cause hamstring injuries. In addition, the pressure on the neck can lead to cervical vertebrae issues. Inexperienced yogis will typically rest on their head before attempting full wheel asanas. This causes a strain on the neck and head, which can take a long time to recover. Despite the benefits of yoga, there are many ways to injure your back. While you can try to avoid these injuries by following the proper technique, there are some exercises that should be avoided at all costs. For example, a person who is suffering from neck or shoulder pain should avoid doing bridge pose. If your back pain is persistent or recurring, it may be necessary to seek medical attention. A physical therapist or doctor can advise you. A recent survey by Forbes showed that 37 million people in the U.S. practice yoga. The main purpose of yoga is conditioning the body and mind through a series of postures and breathing exercises. Moreover, the practice can also promote mindfulness and maintain a balance between the body and mind. Yoga can help people suffering from low back pain by strengthening muscles that support the back. These include the paraspinal muscles, multifidus muscles, and transverse abdominis. Besides strengthening the muscles, the yoga practice can also help patients with emotional back pain by relieving stress. Moreover, breathing correctly can help alleviate any anxiety. Proper positioning is essential for preventing back injuries. The proper posture will help you maintain a healthy weight and avoid overstretching and bending the back. This will also help prevent osteoporosis, a condition that can lead to bone fractures. In addition, a healthy diet and plenty of physical activity can help you avoid the development of back pain. It can cause knee injuries. Although yoga is often seen as less strenuous than other forms of exercise, there are some common poses that can cause knee injuries. Because the knee is a complex joint, injuries can range from minor to severe. Common causes of knee injuries include overuse, improper movements, and excessive force on the knee. In addition, certain poses can aggravate existing conditions. Some yoga poses, especially those with high impact, can cause knee injuries. For this reason, you need to modify your poses accordingly. Injured knees should be protected by padding, ice, or other support before you begin a yoga exercise. If you are already experiencing pain in your knee, stop performing the exercise immediately. Other poses that can cause knee injuries include lotus pose and the one-legged king pigeon pose. These poses cause knee hyperflexion and rotation, which can damage the meniscus. To prevent this injury, you should limit your knee rotation during the exercises by using props or preparatory poses. You should also avoid the knee over the ankle while performing lunges. While some types of yoga poses can cause injuries, they are helpful for other types of knee pain. Having an understanding of how the knee joint works will make it easier for you to utilize yoga properly. If your knee is affected by ligament or meniscus damage, yoga may be beneficial for you. You can also use yoga to recover from a knee injury and improve muscle function. The most common yoga pose that can cause knee injuries is Padmasana, or a variation of it. In this pose, your left knee must be parallel to the back of the mat. Your right foot should line up with the inside horizontal edge of the mat. This can lead to a condition called bursitis, which is an irritation of a fluid-filled sac. Although yoga is beneficial for strengthening the body and increasing flexibility, there are many mistakes that can cause knee injuries. The first step is warming up and stretching before practicing yoga. Keeping good posture will ensure that your core muscles are working efficiently. It can cause osteoporosis. The Mayo Clinic has reported that yoga is associated with a decrease in bone density and osteoporosis. Osteoporosis is a disease that affects people who have low bone density and are prone to breaking bones. It is estimated that more than half of all Americans will suffer from osteoporosis at some point in their lives. The study's findings have prompted further studies into whether yoga can help people with osteoporosis. The practice of yoga can help osteoporosis sufferers strengthen their bones and muscles while reducing their risk of injuries. However, it is important to listen to your body when practicing yoga. The poses you practice should be challenging for you but not beyond your level of comfort. If you experience abnormal pain or discomfort, stop immediately and consult a healthcare provider. Yoga poses that involve forward bends can increase the risk of spinal fractures. If you have osteoporosis, avoid bending forward at the waist. You should also avoid twisting your waist too far. Instead, try to hold a gentle lower back curve while practicing yoga poses. The ideal amount of time to hold a pose is 20 to 30 seconds. Holding a pose for this length of time activates the bones and creates the necessary stress for bone growth. As explained by Wolff's Law, stress on the bones causes the cells to produce more bone mass. Earlier studies have found that yoga can help people maintain bone density and improve balance. In addition, it can improve coordination and balance, which can help prevent osteoporotic fractures. However, the study subjects did not do yoga specifically for osteoporosis, and most were already practicing the poses for other reasons. As a result, the effects were not maximized. Whether or not yoga can cause osteoporosis is a controversial subject. While the evidence is still inconclusive, yoga can be an integral part of an ongoing treatment plan for osteoporosis. The practice of yoga can help reduce the strain on the spine and prevent the pain associated with it. However, it is important to consult with your doctor before starting yoga and listen to your body.